Hello, everyone. Good afternoon. I'm excited to share some new information. Well, it's not new, but it's good information with you in regards to Medicare benefits and programs. So we're getting ready to get started in a second here. Just let us know if they can hear you okay. Can everyone hear me? Raise your hand if you can hear me. Let me know. Okay. So we're going to go ahead and get started. I just wanted to give you a brief overview as to understanding Medicare programs and benefits. First of all, I wanted to share with you that Knollwood is a not-for-profit organization here in Northwest Washington, D.C., and we are a proud provider of Medicare services to the community. So I just wanted to share with you some things that will help you have a better understanding of the Medicare benefits. So first of all, what is Medicare? Medicare is actually a federal insurance that was developed in the United States originally for people of the age of 65 and older. At some point in time, they realized that there were other people in the United States that could benefit from utilization of the Medicare program as well because of their chronic illnesses, one of which is end-stage renal disease, people that are receiving hemodialysis, and the other is ALS and the Lou Gehrig's disease, both of which are chronic illnesses, but it also has a long-term care disability effect on some people, which is the reason why they are now included in the Medicare program. The Medicare program was started in 1965 under the Social Security Administration, which is now being administered and monitored by the Centers of Medicare and Medicaid Services, called CMS, better known as CMS. That is now the administrators of the Medicare program here in the United States. Originally, when Medicare was suggested in the United States, it was suggested because there were people, elderly people that were serving in the military, and their dependents were not able to shift their benefits from the officers to their dependents when and if something was to happen, or the passing of a soldier. So again, President Dwight Eisenhower, he was a visionary. He was an advocate for senior care and senior health, and he was the first president that created a conference in regards to aging and putting in place different benefits and services that would actually serve the elderly in this country. So in 1961 is when he proposed the Social Security benefits. He had made many attempts to pass the Medicare and the Social Security benefits in Congress. Unfortunately, in most cases, I think it might have gone through Congress 3 times before it finally got through. So in 1963, the bill for Medicare, the Medicare program, and increasing Social Security benefits was passed in the Senate by a 68 to 20 vote in 1963. Again, President Eisenhower was a visionary, and some of his legacy still lives on today, and I'm excited about it. And one of the things that why I'm so excited about it is being a provider of services here at Knollwood. Knollwood is also the originator of another program that was started by Dwight Eisenhower and his wife, Mamie. Knollwood also is an organization that started out as primarily providing for benefits and services for military officers and their wives. And then in the past 5 years, we've now opened it up to civilians as well, as long as you can qualify for our admission criteria. So we're excited about the fact that he was such a visionary. We get to live and breathe all of the things that he was projecting to happen in this country right now today. And still, we still see that these are services that are in need of. So why it's so important to vote from when Congress are putting these things in up for vote, it's important for us to still place our vote so that we're looking out for the best interests of our seniors here in this country. Also wanted to share with you in 1965, under the leadership of Lyndon Johnson, the Medicare benefit Title 18 in the Social Security Act was then passed as well. Lyndon Johnson has signed the Social Security amendments in 1965, in July of 1965. At that time, President Truman and his wife were the first benefactors or recipients of the Medicare program. So it was a program designed to help everyone, no matter what their disease process is, and no matter what their socioeconomic status is. It's a program to help all seniors in this country age 65 and older. So I want to share with you the different Medicare benefits. We have Medicare A, B, C, and D. I'm going to break these down to you so that you have a better understanding, if you don't already, of what Medicare A looks like. So Medicare A covers hospitalization, skilled nursing, and hospice services. Medicare B covers outpatient services. Medicare C, in particular, I say C for commercial, covers alternative programs such as managed care and managed care and advanced managed care advantage programs. And then you have Part D that covers prescription drug services. So those are the things for Part A, B, C, and D. And then I'm going to give you a breakdown of all four. So Medicare A, and I say this is an acronym that I use for A. A is for acute care hospitalization. You have to be formally admitted to a hospital. And when I say formally admitted, that means admitted in inpatient services, not in observation, but admitted into the hospital. And in order for you to use your skilled nursing facility benefit, you would have to have been formally admitted into an acute care hospital for 3 overnight stays, so 3 midnights, in order for you to be eligible to utilize your Medicare benefit at a skilled nursing facility. The other areas of which the Medicare A benefit actually service is home health care. Not home care, home health care. Home health care is a service that is provided by healthcare professionals that are licensed. When I say licensed, it has to be a licensed nurse, a physical therapist, occupational therapist, or a speech therapist, a nurse practitioner, or any other licensed healthcare professional could make you eligible for home care services at home. Also, you need a physician's order in order to receive those benefits, because they want to make sure that that's clinically appropriate. Then the other area of services that's also covered by Medicare A are hospice services. Hospice services, a lot of people don't even realize that that's a benefit as a Medicare recipient that is available to you. It has no charge, but a whole lot of services and programs and resources that are available with your Medicare A benefit. The one thing I want to caution you on, because I think sometimes people don't really understand this, Medicare A does not cover custodial care. So if you need long-term care, that's not covered by Medicare A. If you are at home and need home care services that are custodial, which means you don't require a healthcare professional that's licensed, Medicare A doesn't cover those services either. So in short, Medicare A services are for short-term services. If you need long-term care services, there are other insurances that will help you with that. Going to Medicare B. Medicare B covers outpatient services, any secondary services. Medicare B covers physician services in many cases. While you're in a acute care hospital, a lot of times your Medicare B coverage is covering your physician services. If you're in a outpatient setting or a physician's office, a lot of times some of the care and services that you're getting are covered by your Medicare B benefit. Supplies, equipment, durable medical equipment such as walkers, crutches, wheelchairs, commodes, beds can be covered with doctor's orders by your Medicare B services. And the other thing that is covered by Medicare B are prescription drugs. And there's certain prescription drugs that falls under the Medicare guideline formulary. So that's it for Medicare B. Medicare C, C for commercial, I say that, and commercial is better known as managed care and Medicare Advantage plans. But in short, it's a Medicare commercial insurance provider that covers all four of your Medicare benefits, Part A, Part B, Part C, and Part D. They manage all of your care needs if you opt to sign into a Medicare C commercial insurance provider programs. With that being said, once you are adopted into a particular provider's network, they are now in control of helping you best manage your Medicare benefits. So be very careful in the selection that you make when you're opting into a commercial managed care Medicare program. In particular, I want to shed some light on this. When you're making these choices, you need to be very careful about a few things. One of which are all the doctors that you prefer in network with that commercial insurance provider. If they are not, then you will have to pretty much go with other physicians that are in network with that particular insurance program. That may not be your choosing. Some of us, especially if you're 65 and older, you've had the same physician for many years and you built a long-standing relationship with him or her, and you don't want to change physicians. So just make sure when making these choices that your preferred physicians are in the network with the insurance that you're choosing. The other thing is, if there's any consulting physicians, you want to make sure they're in your network. So if you're a diabetic and you see a particular endocrinologist, you want to make sure he's in that program. If you're someone that have heart disease and you want to make sure your cardiologist that you can maintain your relationship with, you want to make sure that he or she is in that particular program. The other thing you got to be really careful for is that provider going to handle all aspects of your care? Sometimes you can limit your options when you are picking service providers that are outside of the network. Perfect example, if you wanted to go to a skilled nursing facility and you had an insurance, and let's say it was Aetna. Not saying that there's anything wrong with Aetna. I want to make that disclaimer right now. But if they're not in network with a skilled nursing facility that you chose, then you wouldn't be allowed to go to that facility, and that may be your first preference. So you kind of have to go under the guidelines of which providers are in the network and which you choose. So making that choice is very important. The other thing that's very important when it comes to making decisions about what insurance in particular you're going to choose is what medications are you on? Are they in formulary with that particular provider? Because if they are not in the formulary, then it'll be an out-of-pocket expense. And we want to avoid all out-of-pocket expenses if we can. While we're talking about out-of-pocket expenses, one of the things that I want to make sure you really understand is when you pick a Part C commercial provider, there are some annual out-of-pocket expenses, such as could be as high as $1,500 to $8,000 per year. The other is when you pick an commercial insurance provider, you don't have a lifetime coverage. Sometimes the relationship is limited. So you want to make sure you're making the right choice when you're making these decisions. Long story short, what I will say to you is this. If you stick with the generalized Medicare benefit A, B, and D, what you have is a federal insurance that you can go anywhere in the country that has a certified Medicare provider under the guidelines of CMS, the Centers of Medicare and Medicaid Services. You can go anywhere and get those services. You have more choices and options. When you're locked into a commercial provider, you have to go within the network in which that particular insurance provider will allow and approve. So I just want to make sure you were aware of that. So let's go to D. So Part D, it talks about D for drugs. You got to make sure right now, one of the things I will say, Congress is doing a good job at advocating for seniors and making sure that their medication and their drug needs are being met. So you want to make sure when making choices in regards to your Medicare providers that they're giving you a prescription that is in the formulary under the Medicare guidelines. Just know that you can always ask for generics that'll be less expensive. And ask your local pharmacy if you are a Medicare recipient. Are there other coupons and discounts that can be applied to your insurance benefits? Again, I will say to you, Congress is doing an amazing job with making sure that seniors' expenses for medications are very limited. I know in 2024, Congress passed some legislation that has helped maximize the cost for insulin and the supplies and equipment needs for diabetics to be able to manage their disease. Imagine being a diabetic and you have to make choices and options as to whether or not I can afford my insulin. And this is a life-threatening disease that if I don't have the proper treatment and medication, my life and the quality of life is being altered. So again, make sure you're making wise choices. If you have any questions or concerns, you can actually call the Medicare office and get some guidance on that. And I'll share with you some references on how you can get in touch with them later on in the presentation. Let's move to the next slide. In summary, I just wanted to share with you a few things. Knowing what the Medicare guidelines are, the Medicare Act was put into practice by Dwight Eisenhower in 1956. The bill in 1963 was actually passed in the Senate by a 68 to 20 vote. With Lyndon Johnson, he actually was the one who actually signed the Social Security Act, Title 18 in 1965, that would help provide insurance benefits to all seniors aged 65 or older in this country. The Medicare benefit was created primarily because 60% of the people in this country were people 65 or older at the time, and they could not afford insurance. It wasn't available or it was unaffordable. And the reason being is because as you got older at that time, the insurance cost was 3 times the amount for anybody else under the age of 65, which made it very difficult for people to be able to manage. henceforth, 75% of the people that are Medicare recipients in this country right now, they're able to be dual eligible because of the fact that the Medicare benefit is relatively expensive at that time. Medicare has been operating for over 60 years. Even today, Congress is still trying to make sure that we're securing the rights and the privileges of the seniors in this country to receive Medicare benefits. And some of those are physical therapy, speech therapy, and occupational therapy. So those are some of the things that we still are fighting for at this time. In 1970, we had added to our Medicare benefit the ability to have organizations, HMOs that were now managing the Medicare benefit for seniors in this country, which is what is now called Medicare Advantage and managed care. And in some cases, it really is helpful to some people when they're in the community. But when you need other resources or have to go into skilled nursing facilities or other organizations, it does become rather problematic if someone else is making your choices for you versus you have to stick to what providers are in network. In 1984 is when the other benefit was put in place, and that is the hospice benefit. I solicit to you that most people don't even enact utilizing their hospice benefit until they are anywhere from 10 to 14 days at the end of life. But there has been statistics that indicate if you opt to utilize your hospice benefit early on, your quality of life at the end of life will be much, much better. So I want to share with you that. I got a question here is what is the definition of acute care as it relates to Part A? So acute care just means hospitalization, acute hospitalization. So acute care would be a actual board certified hospital like Georgetown, Sibley, Washington Hospital Center. Those are acute care hospital providers. There are two long-term acute care hospital providers in the District of Columbia, and then the rest of us are skilled nursing providers in this country, home care and hospice providers. So those are the areas in which Medicare A benefits can be utilized across the continuum. So the other is, again, in 2021, we realized that 2001 is when we realized that there were a lot of younger people that had been diagnosed with a chronic illness that really needed to utilize the benefit of the Medicare program, which is the reason why Congress passed the law to allow for people with end-stage renal disease, receiving hemodialysis, ALS, and Lou Gehrig's disease to be able to be a recipient of the Medicare program. Also, Congress passed and expanded the eligibility so that younger people that had disabilities and were the recipients of Social Security disability insurance to be able to utilize the Medicare benefit as a supplement as well to the care and the services they needed due to their chronic illnesses. Again, 1970 is when the HMOs were introduced, and that was done by Bill Clinton. And that has been something that is still in existence and thriving very well in this country right now. And some people, it really is a help and a blessing to them because they may not really understand how to navigate the healthcare system and how to navigate their insurance benefits. In 2023 is when, again, 2003, I apologize. 2003 is when President George Bush enacted and had Congress pass the regulation for Medicare benefits to be able to cover expensive medications. That is really important. You know, we get clinical insurances and diagnoses, but if the therapeutic intervention is a medication that's not affordable, it kind of is a moot point. So thank God that he had that foresight to indoctrinate that into the Medicare benefit as well. Next slide. So just wanted to share with you a few things. Number one, this is open enrollment time. Open enrollment is the same time every year for Medicare beneficiaries. It's from October to December. This year, the last date for open enrollment is December the 7th. So it's not too late. You've seen my presentation. I'm sure you've seen the commercials on TV. But if you did have any questions before, I hope this has made it a little bit easier and brought forth some clarification as to why you should be very careful in making choices in regards to your Medicare benefit. The other is you can always go to Medicare.gov, answer any questions and concerns that you may have, or go to CMS.gov. They will also have answers and questions for you as well, so that you are making an informed decision and choice in regards to your Medicare benefit. And last but not least, I want to end this presentation with saying to you, if you have any questions or concerns about Medicare benefits, you can feel free to come and tour, email, or call Knollwood, and we would love to have you come by and sit down and have a one-on-one discussion with you about our Medicare services and our Medicare program here at Knollwood. Knollwood, I am happy to say, is a 5-star skilled nursing facility here in Washington, D.C. We also recently received the recognition of USA News Today, rating that we are also one of the premier facilities in this country, providing skilled nursing services. And listed in the next slide will show you about what our services include: 24-hour nursing care, personalized care and services, therapeutic programs and activities, skilled rehabilitation, assistance with bathing, dressing, feeding, toileting and grooming, transferring, medication management, and a plethora of other supplies and services that we are happy to go over with you on a one-on-one basis. But we're excited about what the work we're doing here. We have an awesome team that is providing stellar care and services, and I invite you to come and tour at any time. Our call and make an appointment, the number is 202-541-0149. Thank you so much for sharing your afternoon with us. And again, if you have any questions or concerns, you can come and schedule a one-on-one with anybody in the sales and marketing department. We would love to have you and show you around so that you would know what resources and options are available. Thank you so much and have a great day. Bye-bye.